Do you know the symptoms of vein disease? Well, this morning we want to welcome Dr. John Milligan from Milligan Vein to Daytime to give us answers to questions concerning vein disease. Good morning, Dr. Milligan.
Good morning. Thanks for having me here.
Absolutely. Let's talk about this. What are some of the symptoms of vein disease?
So, symptoms of vein disease. A lot of people say, I've just gotten a little bit older and my legs are heavy, they're tired, they ache. You don't have to have big ropey varicose veins to have vein disease. If you have Charlie horses at night and cramps, you have to get up, rub your legs, walk around the room, there's a very good chance you have leaky veins. That causes poor circulation. Without you walking, you don't get circulation to your muscles, and therefore your legs ache, cramp, and hurt.
I love that explanation. It's just that simple.
It's just that simple. It's all about directional flow. As we age, I don't know if anybody's looked in the mirror, but all of a sudden things start to stretch and sag, and your veins do exactly the same thing. The veins stretch out, begin to leak, you get poor circulation, and everybody says, oh, I've gained a little weight, I've gotten a little older, and that's why my legs get heavy, my legs are tired, I'm just a little out of shape. But truly, it's actually a mechanical problem related to age that nowadays we can correct, and it's pretty easy.
So what are some of the treatment options that you offer?
So compression socks, insurance makes you wear compression socks for 3 months, but it really doesn't fix it, it just kind of manages the symptoms. You come into the office, we actually offer anesthesia to kind of knock you out so you don't have to feel me working on your legs and rerouting the veins. But basically I go in, seal the veins closed, and which forces your body to reroute blood to healthy veins, increase your circulation, and make you feel better.
And, you know, we were talking about, the results. Everything, the proof is in the pudding. Talk to me about the results that you get with your treatments.
So average patient says they're between 70 to 90% better. All of a sudden they can walk, and going up the steps, they don't drag their legs, they walk up and don't even use the handrail.
Right.
I've had patients come in and they're in a wheelchair. Eventually they come in, all they have is their walking stick. So it's very rewarding to make people live better.
Do you see this more in men or more in women? Or is it half and half?
Well, women, because of pregnancy, their belly stretches out, puts back pressure on the veins, and can blow out their veins. So women, it happens to them earlier. By the age of 60% of the female population actually has leaky veins. It happens to men as well. So risk factors, obesity, being overweight, causes back pressure on those veins. If your mom and dad have varicose veins, it's genetics. They give you stuff and your veins just aren't tough enough, and they're more like Stretch Armstrong. They stretch out and your valves don't work. So those are the two biggest risk factors, is weight, and then you also add in age. Once we get to be a high mileage vehicle, things stretch out and begin to leak.
And maybe the type of work you do, maybe you're on your feet more than other people. Is it being on your feet or sitting more conducive to vein?
It's actually both.
Right.
But if you do too much of one or too much of the other. So if you end up sitting in your truck all day, pressure builds up in your legs. If you have a factory job and you're standing still, or you're a cashier, those things cause you to stand still and put pressure on those veins. The taller you are, the higher the amount of pressure pushing on your veins.
Oh, wow. Never thought about the height being an issue there. Let's talk about your new practice here in Johnson City.
So I've been in Knoxville, Crossville, Nashville, Morristown for years. Now we're happy to come to help Johnson City. So it's all about, experience. When you come to our practice, you see the doctor. We'll kind of evaluate you and make sure you need to be here. Once you're here, you'll have to wear compression socks for 3 months. It's not my rules, but it's the insurance rules. During that time, you'll be evaluated with an ultrasound and then come back in and see us. Then I'm able to go over your customized roadmap and know exactly what's wrong with your legs and figure out how to fix it. So when you come to fix it, I don't think anyone else in town's offering anesthesia, but you can come in, be sedated, like a little twilight sleep, and you wake up and say, when are we getting started? And it's already done.
And I like the fact that you got that customized roadmap for each person.
Oh, most definitely. It's all about analyzing the patient, analyzing the roadmap, and getting the results.
All right, Dr. John Milligan, appreciate you so much. Let's give everyone some information right now about Milligan Vein. It's located right up here on University Parkway, real close to the station here. Give them a call. Check out milliganvein.com as well. The preceding portion of Daytime Tri-Cities was sponsored by Milligan Vein.